Mr. Xavier. Are you okay?
Where am I?
You're just at the hospital. You just got admitted because you had a fall outside, but everything's okay. We're here to help you.
What am I doing here?
You're fine. Everything's okay. We're here to help you.
I just want to go home.
You just had a fall, sir.
Am I right? I just want to go home.
Sir, Mr. Xavier, come back here. Mr. Xavier, I know you're upset and confused right now, but you just had a fall. We need to be safe. I'm here to help you. Your daughter's on her way. Let's get back seated and we can discuss about this with your daughter, okay? You just need to be safe and seated.
Okay.
Okay, let's go back. Okay, all of your pillows are all set now?
Thank you.
No problem.
So happy Form's coming.
Oh, really?
She's such a lovely young lady.
Mm-hmm.
Did you know she's studying to be an engineer?
Oh, that's amazing.
Yeah.
You must be so proud of her.
Very proud.
Mm-hmm.
Is she on her way?
She's almost here.
Perfect.
Okay, just have some rest.
Yep.
What's the matter, Mr. Xavier?
Can't find my damn hearing aids.
Oh no. Okay, you know what? Just relax for a bit and I'll help you find it, okay?
Alright.
Hi, excuse me, I'm looking for my dad. The receptionist said he'd be somewhere here.
Are you Miss Form?
Yeah.
Mr. Xavier's daughter?
Yeah, I'm
Oh,
looking for
perfect.
him. I heard he had a fall.
Yes, he was just looking for you, but he's fine right now, but I believe his condition is more than just a fall.
More than just a fall? Is he gonna be okay?
We'll wait for the doctor to come by.
Okay. Hey, Dad, there you are. The nurse outside said I'd find you here. Are you okay? I heard you had a fall.
Who are you? Are you Nikki?
What? No, who's Nikki? No, Dad, it's me, Forum. I'm here because the nurse called me and she said that you had a fall. Are you okay?
Oh, Form, sweetheart. I was waiting for you this whole time.
Yeah, well, I'm here. What happened?
Can you find my hearing aids?
Hearing aids? What? Dad, you don't have hearing aids.
Is everything okay?
Young lady, do you know where my hearing aids are?
No, I'm so sorry. I don't know where they are, but I can help you find them.
What? Wait, no, Dad, relax. You don't have hearing aids. What are you talking about? Why are you acting like this?
The doctor will be here soon.
Hi, I'm Dr. Vinet.
Hi.
I will be your doctor for today.
Yeah, the nurse said you'd be able to explain to us why my dad's been acting a little differently.
Absolutely. So he came in here, he exhibited feelings of confusion, frustration, anger, and fear, as well as some difficulty processing what he saw. He also had difficulties with mobility and balance when we performed the physical exam, so we decided to perform a few extra scans, a few brain imaging scans, and we determined that you do have dementia.
Wait, dementia? What is that? What?
It's definitely not as scary as it sounds. If you'll step out with me, we can discuss care options for your father.
Yeah, I'd really appreciate that.
Perfect.
So, dementia, that's what my dad has. What even is dementia?
So dementia is actually a general term for a decline in mental processes, which include mental abilities such as thinking and reasoning, a person's functioning, behavioral change, memory loss, problem solving, or communicating, as well as the ability to perform everyday tasks. It also affects their senses of sight, touch, taste, smell, and hearing. However, your father is not alone in this. Dementia is one of the most common types of neurodegenerative diseases among the older population.
Yeah. So, my dad fell. That's how he ended up at the hospital. Is that like a risk factor? Is that something that I should be expecting more of? Do I have to be worried about him falling all the time?
So there are different personal risk factors that cause people to fall. However, people with dementia are at a greater risk because they are more likely to experience problems with mobility, balance, and muscle weakness. They can have difficulties with their memory and finding their way around, processing what they see and reacting to situations. As well, they are at a greater risk for feeling depressed, and they may have difficulty communicating their worries, needs, or feelings.
This sounds terrible. Is there a cure? Something that I can help him with?
So there is no cure for dementia. However, there are a number of different drugs that aid in controlling behavioral symptoms, as well as multiple therapies such as music therapy and aromatherapy that restore mental function, as well. Also, being active has proven to be quite an efficient therapy for dementia.
Okay, so I think I'm starting to understand what dementia is and how it affects people, but I don't know how to care for someone for dementia. What do I do? Like, how do I look after someone with dementia?
So the physical and emotional demands of caring for someone with dementia are quite high. Dementia is not an easy situation to deal with, and to be honest, your father will need more supervision and assistance as the disease progresses and worsens over time. So home care is a very viable option in terms of caring for dementia, and there are a number of support systems in place to help you with this, such as support services, short-term care services, and other services, which help people with dementia remain living in their homes, such as the home and community care, as well as the home care programs. And do you have any other questions for me today?
Not at the moment. I think that covers my understanding.
All right, well, if you do have any more questions, here's a pamphlet about dementia. It has all the information that I just listed, as well as more. You can also ask your family doctor any questions that you do have, and it is important to get your dad routinely checked.
Okay, thank you very much. So the doctor told me that my dad has dementia, and now that I'm his primary caregiver, do you have any tips and tricks for how I can help him? Because this is very new to me.
For sure, I know it can be quite challenging, for sure, with working with someone who has dementia, but there are some communication strategies that you could use.
Yeah.
So making sure that your dad's in a calm environment, making eye contact with him, giving clear directions, and being calm and being patient with your dad is always important. And also not to give up on him, just help him express his feelings. And always, it's really important to not argue with him at all.
And what happens if an argument does arise? Because sometimes that happens.
Yes, it could happen, but always, when it does happen, just acknowledge them for what they're doing and his feelings, giving him brief response, and maybe using a redirection method, just distract him from that.
That makes sense. Thank you.
We're gonna be all right, Dad. Let's go home.
Sounds good.